Okay, now we can panel discussion. So of the panelists, we're just going to stand up here because it's easier for the videotaping. And just so you know, we're videotaping for all those that couldn't make it today. So this will be posted on our website. So if you know anyone, I did get a few notes this morning about people not coming. So everything will be posted on the St. Joe Community Health Foundation.org website under PIC. So today, again, very special. We've got three panelists, Jan Moore from Community Nursing, we have Dr. Holly Seabury, we have from Macmillan Health, we have Pat Turner from Tobacco-Free Allen County, and we have a sub for Paige from Healthier Moms and Babies. So, okay, welcome. So we're just gonna go through a series of questions, but you know how informal this is. So just tell us what you know is the important part. So, I'll ask them, then I'll hand this to you. So please just introduce yourself, tell us about your organization, and describe the services your organization provides to address smoking in our community.
Again, my name's Jan Moore. Thanks for all coming out today. I'm with Parkview Health, and specifically Parkview Community Nursing. I think Carmen in introductions talked a little bit about some of the services that Parkview Community Nursing provides free to the public. So I'm the lead for tobacco cessation for our group. We have Freedom from Smoking, which is an American Lung Association program. It's a 7-week program. They quit at week 4. Then we continue to support them for 3 more weeks in their healthy lifestyle and their healthy choices. We provide that 6 or 7 times a year at the Parkview Neighborhood Health Clinic on Paulding Road. I currently am able to provide it in some of the with some of the agencies that we work with. SCAN. I'm actually finishing a class at the Redemption House, which is a halfway house for women who are in recovery, and then Parkview Center for Healthy Living. It's actually not at this site. It is at this site currently, but they're moving to Woodland Plaza. They provide freedom from smoking as well. So we have North and South Side. Their classes are also free. And then we're working to provide freedom from smoking in all of our community hospitals quarterly, and then a site in Ohio as well. So those are the resources that Parkview is actually providing for our community. We also encourage the quit line at the same time. I'm also a proponent of, if you're involved with Baby and Me Tobacco Free, we have a couple of those clinics, not in this county. I think you're going to talk a little bit more about that. But in Bluffton, they have Baby and Me Tobacco Free. But we do encourage, there's not one set way to quit. If you're in the Baby and Me Tobacco Free program and, you're at month 2, baby's 2 months old, and you're still struggling with your tobacco cessation, take a freedom from smoking class or use the quit line or 1-800-LUNG-USA with the American Lung Association. That's it.
Hi, again, my name is Pat Turner, and I work with Tobacco-Free Allen County. We do a number of things. Brian talked a lot about what we do. We definitely promote the quit line in everything that we do. We do lots of education out in the community as well. I'm into WIC 2 or 3 times a week. Actually, I go this afternoon at 4. We also do education in the schools with young people. One of our target audiences is really young people. You want to catch them before they start smoking. And so we're going to be doing Student Focus on Health with Judy this year as well. So lots of education, advocacy. We want to advocate for smoke-free environments wherever people live, work, and play. So.
Hi, I'm Holly Seabury. You're probably familiar with Macmillan Health for the programs we do in the school. We do a lot of tobacco prevention in the schools with youth, trying to ensure that youth do not start to smoke, and recently now, or vape, or anything else, anything. But what you may not be as familiar with is the work that I do, which is curriculum design and redesign. So we get called in a lot to either redesign a curriculum that someone has that doesn't work the way they want it to, or we get called in to design a new curriculum. And you're probably not aware, one of my first jobs right out of grad school was as a regional director for the American Cancer Society. So I've taught a lot of cessation, and I taught it in the prisons. When CCNO in Northwest Ohio went smoke-free, I was in there teaching cessation to the prisoners. And it was actually a really great experience. But most recently, because they can't cheat. It's awesome. You're smoke-free whether you like it or not. And if you do get a cigarette, let me tell you how it got into the prison, and you're probably not going to want to smoke it. If anyone wants to know how it gets in, I'll tell you afterwards. So most recently, we are in discussions right now with the Indiana State Department of Health, and I assume this is the same department you're from. They have a curriculum called Getting a Head Start on Living Tobacco-Free that was designed for the county coalitions to use with mostly Head Start. It hasn't worked as well for them as they've wanted it to. And I happened to be on the Oral Health Coalition with one of their staff members, and they saw our latest curriculum, which is our Healthy Baby Teeth for Children with Special Needs, and said, oh, could you do this with our tobacco stuff? Yeah. So what we're talking about right now, and it's gone to the procurement process, which apparently needs everybody from the governor on down to approve it. So what we design is materials that are designed specifically for the Medicaid population. They're graphics heavy, they're word light, they're very low literacy, and we design them so the parent sees the side with much fewer words, and then on the other side we guide the professional through the conversation, assuming that the professional doesn't do this every single day. So we're guiding them through the conversation. We offer a lot of high quality training that's actually fun because I have to be honest with you, training on most health topics is pretty deadly. And then we offer really colorful, really nice graphic handouts. This is actually from Johns Hopkins. We redesigned their asthma education materials. They had the same issue. It was very print heavy. Parents couldn't understand it. Head Start staff couldn't understand their asthma materials. And this is, we redesigned the whole curriculum. We wrote a children's book. We do a lot of children's books. And then this is one of the parent handouts on asthma triggers that we redesigned for them. So that's what we do, and hopefully that's what we'll be doing in the upcoming year with tobacco prevention and really trying to help Head Start families look at the different domains of their life and how do they keep their children smoke-free. One of the real realities we have to accept, we work with Head Start and WIC nationwide, is that in many states marijuana is legal, and a lot of people are smoking marijuana in front of their children. So we do have to include that now in along with secondhand smoke, thirdhand smoke, smoking while pregnant, covering all the different domains of a child's life as far as childcare in the car, at your house, at relative's house. We also now have to cover smoking marijuana in front of children and vaping in front of children. So it's just harder than it used to be. 20 years ago, there was a lot less I had to cover, so.
Hi everyone, I'm Betsy with Healthier Moms and Babies. Speaking on behalf of Paige today, who couldn't make it. We're really, really thankful because we have been granted the Baby and Me tobacco-free program. So we're gonna have more information coming out in October, but if you're not familiar with that, what we will be doing is providing smoking cessation counseling for pregnant women. And they have to go through 4 counseling sessions, and essentially once they're tobacco-free, they'll be able to get diaper vouchers. So that's the incentive, and it also works for anyone else in the home. So if another person in the home quits as well, they'll get diaper vouchers for that too. So it's a nice incentive. And I know that we'll be going through our training in November for that. So just be looking for more information coming in October for that program to start. Thanks.
Okay, so the second question is, Please describe the process for engaging in your program and if there's any requirements for enrollment or anything special that this group needs to know.
Most of my flyers have my phone number on them, or you can call the Parkview Center for Healthy Living, and they can direct you to the next class. There's no requirements. They're free. Just a desire to quit.
Ditto. Just call us. We're available. We have an office number, but because of what we do, we're out in the community a lot. And so we also will give you our cell phone numbers. Just call us and you can get a hold of us. Email also.
Text.
Yeah.
Yeah, we're the same. If you would want a youth program on tobacco prevention, we also do adult programs. You just call Macmillan Health and you schedule it. We have a lot of grants available, so most times schools aren't paying for this. As far as this curriculum, when it comes out, they'll mainly be marketing this to Head Start and other Medicaid-focused early childhood. So hopefully a lot of agencies will be using it, and they're looking at covering all the costs of training and print, so there will be no charge to use that curriculum.
For Baby and Me tobacco-free, obviously eligibility, you have to be pregnant. But for any more information, like I had said, it'll be coming more in October when we'll get more information for that. But our main contact person would be Paige Wilkins with Healthier Moms and Babies. So you could either email us or call our office, and I'm sure she'd be willing to give you more information on that.
And I'm also going to give, is Patty still here? Patty Bray? I was last here 3 weeks ago when my grandson was born. And I should have brought a slideshow. But everything went well. So kudos to Parkview Working Center.
There you go. Okay. Please tell us what needs to happen in the community or certainly in this child or women of childbearing years and pregnant women population to reduce our smoking rates. I mean, obviously they're going up, they're not going down. So what is your insight?
Abracadabra. I don't know. I think just, continued education. The more we can get out to, even in the schools. I think Gina's here, and then she talked about, having a mother's room in the school. Just knowing that, the kids that are in schools, they shouldn't. We want them not to smoke. So having Pat and the schools involved, and just keeping the education, more messages, just going. I don't know what else to say.
Yeah, I would agree with Jan. Education is key, and community collaborations. I mean, any place that you come into contact with a woman of childbearing age, ask them if they're a smoker and provide information to them. That's what we do. I mean, I do it just on a personal level when I see people who are of childbearing age. Are you a smoker? Would you like to quit? Yeah. So,
Yeah, I would agree. Education is key. It is way easier to prevent someone from smoking than to help someone quit smoking or any type of tobacco use, vaping, anything. So education, getting kids when they're young, and repeated messaging, not just hitting them once. And then, the population I work with is predominantly the professionals who work with Medicaid moms and children. They need good, high-quality resources, and they need resources that are research-based. Like, for instance, if we end up developing this curriculum, I'll read literally hundreds of research articles, honing in on the language, the messaging, what research has been shown works as far as the messaging to moms, the messaging to family members, which may be different than the messaging to moms. And so, professionals who work with families need really high quality, low literacy, great materials that really resonate with the population they're working with. And we need to be creative. We need to look at text messaging and video and children's books. You know, there's great research that shows when you teach very, very young children, preschool age children, they bring the health messaging home, and more changes are made in the home when you come up through the children. So how do we work to bring that messaging home through children? So how do we be creative but effective and research-based?
I totally agree. I think education is definitely the key. I also think something that we found with Healthier Moms and Babies is the support. It's not easy to quit. We all know that. And if you haven't been through the addiction, I know it's a little harder to understand, but, you know, supporting our moms, keep encouraging them, even if we hit them over the head sometimes with education, they don't really want that. They just want your support and encouragement. And I have one mom right now, just speaking from experience, who really wants to quit. And she's like, "You're my accountability." So when I come see her, I'm her accountability, and she's excited about that just from the support she's getting to be able to quit.
And I will say real quick, too, we really focus on motivational interviewing in our materials because people know the right answer. You haven't smoked this week, right? Right. You know, and so it's tell me about your tobacco use this week, you know, and really helping them to be more truthful so we can help them better when we know really what's going on instead of, you know, I always joke, like when you go to the doctor, you're exercising 3 times a week. Sure. Uh-huh. And you're eating 5 fruits and vegetables every day. Yeah, sure I am, you know.
So we started this session off with what are our gifts, because we have so many wonderful organizations. So please tell us what the members of our network and those in the community can do to support your efforts or all of our efforts.
These are hard questions. You know, if you know a pregnant mom who's smoking, and all of us can help. But I think that's it. And, you know, just knowing where to send someone who would like to quit or has an interest in quitting, knowing those resources in the community to help them quit, whether it's the quit line, whether it's a formal class, whether it's baby me tobacco free. So,
okay, 2 things. I have answers. One is, if you're not a member of Tobacco Free Allen County's Coalition, I invite you to become a member. We meet on the first Tuesday of every month at 3:30 at Matthew 25. I'd like to see a number of you there next month. The second thing is to become a Provide employer organization or provider employer or organization. So that means that you can refer people to the quit line. So I'm going to ask you to get a hold of me, or before I leave today, give me your business card, and one of us will get you signed up to become a preferred person so that you can refer folks to the quit line.
If you work with any schools or youth groups, our classes are there and ready to go for all ages as far as tobacco prevention. So keep that in mind. If we do get the contract to redesign the state curriculum, we will be putting together an advisory group. We don't design curriculum in a bubble. We have an advisory group of end users who really work with us through the process. So I will be reaching out to a lot of you who may be end users and asking you to serve on an advisory group.
For Healthier Moms and Babies, referrals for any pregnant women. For us, even if they're not a current smoker and maybe there's somebody in their home smoking, we can provide that education to someone in their home as well. So you can do referrals online. We have an online portal for referrals now. You can also fax, and if you need referral forms, if you like to do the faxing option, just let me know. I'll get with Paige and have her send some out to you. And then Baby's Love is another way as well. Going online to Baby's Love will also get that referral.
So any questions for the group? I don't have any more hard ones. You're yes, just keep.
This is another question, just a comment. The question that you asked about what are we doing, what can we do to bring down the smoking rate among pregnant women? And I just wanted to add that we're doing a lot of it because actually the rates are going down.
Yeah, that is true.
Because I'm just thinking, I used to do the prenatal substance use prevention program at Neighborhood Health Clinic, which was another state-funded, grant-funded So it's gone down, and the smoking rate in general, when I first started that program in 2003, it was above 20% pregnant women in the state of Indiana who were smoking. So we are doing something right, we just need to keep doing it. And I think the biggest focus that we need to keep in mind right now is women may be declining in their smoking, and overall people are declining in their smoking, but an awful lot of young people are taking up vaping, so we've got to hit that hard, or we're gonna have another whole epidemic down the road of nicotine addiction among pregnant women and everybody else. So I think that's, keep doing what we're doing and add vaping into it.
Oh, absolutely.
And keep our eyes out for the new products, because vaping won't be the last one.
Correct.
There's the heat not burn products that are coming.
There's too much money to be made.
There is, absolutely. Yes, Sarah.
I just want to thank Betsy for bringing up the other people in the home. I think that's really important to remember, especially when the baby is here, who's smoking around the baby, even if it's not the mom. That's a huge, huge important health issue. So thank you for reminding us of that and being advocates for both our moms and baby.
I just wanted to piggyback on one of the things that Brian shared too, that if we do get any legislative opportunities that come up again to increase the price of smoking, that's something that if all of us speak positively to, I think what they said, there really wasn't much support outside in the communities when politicians ask about that. So if we all were understanding how powerful that is, if we all just spoke up and said, no, that's really a good thing to do, it could help get that piece passed too.
Join our coalition.
It's a hard one because they get lobbied hard by the stores on the borders, and we have a lot of borders, and they get lobbied really hard by those stores who say, we're gonna lose so much business, you're gonna put people out of work, because they'll cross the state line and buy in Ohio, they'll buy in Michigan, they'll buy in Illinois. So it's, it seems like it'd be such an easy sell, like raise the price, smoking rates go down, medical costs go down, death rates. It's not as easy as it seems. That's the problem with all
And let me
legislation.
add to that, because they have numbers, we need numbers on our side too.
Right.
So if you guys want more information, tobacco-free actually goes to those state legislative sessions to lobbyists. So if you want to join with us and help lobby with us, let us know.
We can email out to this group, we will do a follow-up when we get all this videotape online, as Laura said, but we can also send contact information, how to reach all of the panelists up there, so you can easily connect. So we'll follow up, make sure we get all of your, what infos or cell phone or text, or what's the best way to reach you.
I know we're not dealing with this problem right now, but is there anything out there about what the marijuana smoke is doing?
Yeah. And it's bad. It really, I don't have the exact statistics in front of me, but I was just at the Michigan Home Visitors Conference, and their state is looking into developing curriculum for home visitors to use in smoking, and marijuana, medical marijuana is legal there, and they specifically asked me to look into that. That wasn't what my talk was about, but I was reading some research on it. Yeah, it's scary. It can affect children's brain development. One of the things marijuana does affect, whether it's passive smoke or firsthand smoke, is it affects the development of your frontal lobe. And so when children are exposed to a lot of marijuana, it can cause learning issues. It can affect their brain development. It's very scary stuff. And unfortunately, what the home visitors were saying at this conference was a lot of parents smoke in the car. And these kids are getting out to come to preschool, and they said it just billows of smoke, and yeah, these kids just reek of marijuana. And it's a hard sell because it's a medical, they have a medical card in Michigan, and so they're like, but I use this for medicinal purposes, so it can't be bad for my child to be around it. Turns out it is, and so there's a lot of education, because the reality is, even in a state like Indiana, where marijuana is illegal, there are a lot of people smoking. I mean, it's not as though that means people aren't smoking. So I think it is actually a very important part of any secondhand smoke curriculum to discuss that. Now, some parents may just say, hey, this is not an issue. I don't need to talk about this. This never happens in my house. It never will. Okay, great. That's wonderful. But there are a lot of families smoking in front of kids, regardless of whether or not it is legal in their state.
Right.
And the effects are really scary. Really scary.
Any other questions? Sorry. So I want to thank again Brian for coming up from Indianapolis to be with us today. Thank you, panelists. You're absolutely wonderful. We do have an optional tour of women's and children, so see Erin if you're interested. The next meeting is Tuesday, November 14th at DuPont Hospital, so please join us.